If you're a plastic surgeon interested in head neck reconstruction, you have to know how to do a neck dissection. Because if you do the neck dissection by yourself, you're going to save the structures that you're going to need in the next stages of reconstruction, especially when you're doing microvascular reconstruction. And believe me, it will make your life easier. So how do we do a neck dissection? This is a very basic presentation on neck dissection. We will show you what are the structures we are going to remove, what are the structures we are going to save, how do we save them, what is the extension of exposure, how do we expose the neck, and of course the necessary steps. In all textbooks, in the neck dissection chapter starts with radical neck dissection, which we do not do nowadays. Nowadays we do functional neck dissection or selective neck dissection, in which we save all the structures: internal jugular vein, spinal accessory nerve, and of course sternocleidomastoid muscle. So let's see what are the lymph node groups that are present in the neck. This is a diagram of the neck. This is the hyoid bone. You can assume it as the cricoid cartilage. This is the anterior belly of the digastric. And this is the posterior belly of the digastric. You can assume it as the sternocleidomastoid muscle. There is another important muscle, that is omohyoid. It's important for neck dissection. So, between anterior and posterior belly of the digastric, there lies the 1B group of lymph nodes. In the anterior part of the neck, between the hyoid bone and two anterior bellies of the digastric, lies the 1A group of lymph nodes. Along the great vessels of the neck, just below the sternomastoid muscle, lies group 2, 3, and 4 group of lymph nodes. If you draw an horizontal line at the level of the hyoid bone, just above lies the 2, and if you draw a horizontal line from the cricoid cartilage, the number 4 group of lymph nodes lies below. You can see that there are supra and inferior belly of the omohyoid muscle. If we do an supra-omohyoid lymph node dissection, that means we are going to stay above the omohyoid. That means we are going to remove the 1, 2, and 3 group of lymph nodes. There lies the group 5 and group 6. So, like one is group of lymph node is divided into 1A and 1B, group 2 is also divided by 2A and 2B by spinal accessory nerve. The group of lymph nodes lies posterior to the spinal accessory nerve is 2B and anterior is 2A. So, what are the nerves we are going to see or encounter during neck dissection? Of course, we have just mentioned the spinal accessory nerve. At the earlier stages, we have also mentioned that you are going to see the marginal mandibular nerve here, greater auricular nerve. But in the submandibular region, during removal of 1B, you will encounter lingual nerve and hypoglossal nerve. Of course, there are great vessels, internal jugular vein, common carotid artery, vagus nerve in between, and also their branches and tributaries. Omohyoid you should identify to do a supra-omohyoid neck dissection. And what will be the exposure during neck dissection? You have to expose the flaps to expose up to the mandible above, clavicle below, posteriorly to the great auricular nerve, and anterior to the midline or anterior border of the strap muscles. So these are the group of lymph nodes that you are going to encounter and remove according to your plan. And and how will we expose the neck? What will be the incision? Historically, there are lots of incisions like prial incision, Hayes-Martin incision, modified Schovinger incision, but or you can do two parallel incisions like McPhee incision. But nowadays, the most commonly what we use to expose the neck is by a crease line, transverse crease line incision. This is the most commonly used incision, but you can also use a modified Schovinger incision. But remember, the incision will depend upon the excision of the primary tumor. If the tumor lies here, of course you can't give a transverse crease line incision. So the final decision of exposure will depend upon the excision of the primary tumor. We have exposed the neck with a transverse crease line incision. We will raise the upper flap with the skin and plateau, and we will find three structures that we are going to see. Just after raising the superior flap, you're going to see its three structures: external jugular vein, greater auricular nerve, and marginal mandibular nerve. You can sacrifice or save the external jugular vein, but it's recommended to save it, protect it, because you may need it in the later stages of reconstruction for source of venous anastomosis. Greater auricular nerve is important for two reasons. First, it demarcates the posterior limit of the neck dissection, and it also has a sensory function, so you have to preserve it. Among these three, the most important is the marginal mandibular nerve. You should save it. You can save it by two ways. You can directly identify the nerve and protect it, or you can do it in the Hayes-Martin procedure. We're going to show it in the next stage in the diagram. But it's recommended to save the marginal mandibular nerve by directly identifying the nerve, because if you do it in the Hayes-Martin procedure, it's a blind procedure, you might miss some perifacial lymph nodes which might be a source of metastasis. So you should directly identify it and protect it. The Hayes-Martin procedure of saving the marginal mandibular nerve actually depends upon its anatomy. The marginal mandibular nerve lies above the facial vein. So if you just ligate the facial vein and flip it upwards, it's going to flip the marginal mandibular nerve superiorly and keep it outside the level of neck dissection, and it's going to save the marginal mandibular nerve blindly without even seeing or identifying the nerve. But as I've said before, you will miss some perifacial lymph nodes which might be a trouble later on. So it's recommended to identify the nerve. Well, we have to remember that it's not the only way to do a supraomohyoid neck dissection. You'll find your own ways. But I have tried to make it simple and show you all the structures that you will encounter during neck dissection. I hope you have enjoyed it. Thanks.